Thank you. Okay, well, thank you for inviting me here, first of all, to talk to you. I'm a little bit nervous, and I can't guarantee that I'm not going to get upset either. So this is Tommy. He's 18 months old now. He's a cheeky little monkey. He's the apple of our eye, and we are really over the moon that he's actually still here with us, and he is our little miracle. So I'm going to tell you what happened to Tommy. Okay, that's my next. So his story begins back in June 2018 when we found out that we were pregnant. We went to our midwife for a booking in appointment where they ask you all the standard questions about past medical history of both parents and also what I did for an occupation. So it was there I claimed that I was a nurse. Because it was classed as a high-risk pregnancy, I was put under a consultant care. So this involved going several times to the maternity unit for various different appointments, such as scans, meeting the consultants. From 28 weeks, we had to have growth scans every 3 weeks. Went for diabetes checks. So in total, we went to the maternity unit between 8 and 10 times. Also saw the community midwife several times during this time. At 39 weeks, it was agreed that he would be induced. It was a planned induction. So we went in. He was induced, and then labour started. Due to my medical problems, I had to have an early epidural. So labour was progressing, but it was slow. So ended up having to stop the epidural because every time I was having contractions, Tommy's heart rate was dropping. It was then decided that I had to go for an emergency C-section. So an hour later, was taken down to theatres, had an emergency C-section, and Tommy was delivered at 1:41 on the 13th of February. We ended up actually staying in hospital for 5 days just because initially he was having trouble latching on. We were trying to breastfeed, but he was having problems with that. And then he developed jaundice. It was jaundice that didn't need any treatment for it, but they wanted to keep an eye on him. It was at that stage that we decided to bottle feed him. He had repeat bloods done, which were all within normal levels. He didn't need any treatment, so we were discharged home on the Sunday. So Monday, the midwife came out, checked him over. He was absolutely fine. Tuesday, we went out for the first time, went to go around to see his granddad. Nothing abnormal about that. The first couple of nights he hadn't slept particularly well, but he was a newborn, so that was to be expected. Tuesday night, I took him downstairs late evening just because he wasn't settling. Gave him a bottle. He had his normal amount. It wasn't loads, but it was a normal amount. And actually went to sleep in his Moses basket for 4 hours. Next morning, we got up. I took him back upstairs. I went to get some sleep while my partner looked after him. He sort of fed him, changed him, hadn't noticed anything wrong with him at all. Although he wasn't feeding as much as he had been. In fact, he was only taking, by this time, probably about an ounce of milk, so about 30 mils. My sister had come round. She didn't particularly notice anything unusual about him. He was a little bit unsettled when I was trying to move him. If I had him up on my shoulder, he was fine. He was settled. But if I went to move him, he would cry. But this was only for approximately 30 seconds to a minute, no longer, and would settle down. As the day went on, he still was refusing to take his bottle. So I started to get a little bit concerned because he hadn't had much at all. And he was sleepy, but then again, being a newborn, wouldn't expect much different to that. About 1:30, 1:45, I decided that I really wasn't happy about the man that he'd taken. So my midwife was actually on holiday that week, and the replacement midwife, I couldn't get hold of her, so I decided to phone the maternity helpline just to ask what should I do. They advised that we strip him off when we try to feed him, including taking his nappy off, because being exposed and a little bit cooler would make him wake up and therefore hopefully take his bottle. If there was any problems, then I was to call them back. So because I had a C-section, my partner decided to change him. So it was on the floor with him on the change mat, started to undress him. And as soon as he undressed him, he noticed that the whole of his stomach was red. And not just red, it was bright red. It was almost like someone had poured a hot kettle over him. It looked like scalded skin. So straight away we knew something wasn't right. So we took his nappy off, and again he was completely red over his stomach. So I told my partner to lift him up and turn him round so I could see what his back looked like. And then this is when we found the first picture on the left there. As you can see, it looks completely abnormal. It was red, and it looks like what I could only describe as a bruise straight in the middle of his back. It almost looks like a handprint size bruise in the middle of his back, and straight away we knew we had to take him somewhere. So we quickly got him dressed and got him in the car and took him straight to the emergency department at Peterborough. We ran straight in the department, and so because I used to work there, I knew the staff there, and straight away they took one look at me as I ran in screaming, "There's something wrong with my baby." That they took him straight through to the children's area. The nurse immediately started undressing him, and then took one look at his stomach and grabbed him and ran to the resuscitation room with us following. At this time, Tommy was still crying, which with children that are really sick is still a good sign. We got into the resuscitation room, and suddenly there was several doctors and nurses working on him. We were obviously beside ourselves because we just didn't know what was happening, and all I remember saying was that we haven't hurt him. They were struggling to get any access in him because he was shut down, so they ended up having to put a cannula into his scalp there, which they managed to get, so therefore they could get antibiotics and fluids into him immediately. Someone then actually was trying to say that they were taking bloods, they were giving us antibiotics, they knew he was septic but they didn't know what was causing it, and they couldn't understand what this was on his back. Once they'd got the fluids and antibiotics into him, he seemed a little more settled, so I got to hold him, and then that was the last time I would hold him for about 10 days. After that, we were taken round to the Amazon ward, to the high dependency unit, to wait for further treatment, to try and find out what was actually going on. This was probably about 6 o'clock, so at 8 o'clock, the first of our heroes came in, which was Dr. Pewty. Dr. Pewty is a paediatrician at Peterborough, and he came to Tommy's bedside and literally took one look at his back and said straight away, "I know what that is. It's necrotizing fasciitis." I knew about this because, again, of working in the emergency department, and knew how really serious this was. He said that he needed to immediately find a plastic surgeon nearby and a paediatric intensive care bed. So with this, he tried to explain to Tom, my partner, what was going on, but Tom isn't from a medical background, so couldn't really take it in. He then went off to try and see what he could arrange. Thankfully, there was a PICU bed in Addenbrooke's, and the plastic surgeon down there, Mr. Gillespie, happily accepted Tommy. We were then told that he needed to be transferred immediately, and although they could wait for a retrieval team to come and collect Tommy to take him Dr. Pewty really didn't think Tommy had the time to do that, and so we had to go in an ambulance with a nurse escort on blue lights down to Addenbrooke's, and my partner followed behind us in the car. So we were taken down to Addenbrooke straight into intensive care, where we were met by several doctors and nurses who immediately started working on Tommy. And again, that's when we met our second hero, who is Mr. Gillespie, the plastic surgeon, who immediately told us that it was necrotising fasciitis, and the only treatment for necrotising fasciitis was to take Tommy straight to theatre. My partner said to him that he couldn't take him to theatre because he was only 7 days old. He was too young to go to theatre. And we were told that there was no other choice. If Tommy didn't go to theatre straight away, he would die. So we had to sign the consent form, and within an hour he was on his way down to theatre. We went down to theatre with him, and I will never forget the look of the faces of the theatre staff there, who looked at us knowing that that was potentially the last time we would see our little boy alive. So after he went to theatre, we went back to the intensive care, where we had to sit and wait for 5 hours. So anyway, so after 5 hours, so we're now 7 o'clock on Thursday morning, we get the news that Tommy has made it through the operation and that he was coming back up to intensive care. Mr. Gillespie came back to speak to us and told us that he had to, it was confirmed as necrotising fasciitis, and that they did have to debride his back. And at this stage, they removed 6% of his total body surface from his back. They had also then confirmed, they later then confirmed it was caused by MRSA. He told us that although he'd gone through the first surgery, he was still critically ill, and the next 48 hours were crucial. Although in a way we didn't want to know the answer, we asked what his chance of survival was, because we needed to prepare ourselves. And we were told that it was a 40% chance of him pulling through. And if he managed to pull through later down the line and stabilised, then he would need to be transferred to a specialist unit, a specialist burns unit, because then they would be treating it as a burn wound for reconstruction. So we finally got to see Tommy, and this is the picture the next day, or the day after him being in intensive care. As you can see, he's extremely swollen due to the sepsis and everything that's gone on for him. Obviously, he's been intubated, so he was on a ventilator, and obviously looking really poorly. This one. So he would be kept on the ventilator for the time being. And he was on morphine sedation to keep him comfortable, but was awake throughout it and was able to respond to us. And you can see the cannula in his scalp there as well, and that's him looking at his daddy. So He ended up having to go back to theatre again on Friday, where he had more tissue debrided. And they again told us that they didn't know how anything would be with him. It was after the Friday that we were told that this was they had discovered that it had been caused by a rare strain of MRSA, and it was PVL MRSA. And the PVL is like a toxin of MRSA that destroys the white blood cells as well, so it made it even harder to treat. When we were told that it was MRSA, I immediately said it must have come from me, because I work in healthcare. It makes you higher risk for this, but they said they couldn't say where it had come from, and obviously I hadn't been screened, so we didn't know if I was a carrier or not. But we would all be started with our decolonisation treatment for MRSA, which Tommy started straight away. But unfortunately, because we weren't from Addenbrooke's and we had no GP there, we couldn't start ours until the Monday. Because we weren't patients there, so they weren't able to give it to us. So we had to wait another few days. Over the weekend, he was stable, so didn't need to go back to theatre then. But on the Monday, it was decided to take him back to theatre. He'd had more tissue debrided again. This time, they had to remove it was now a total of 15% of his total body surface that he'd lost. They also found on Monday that he had started with another infection, a different type of infection on his back that was caused by having such a large open area. So he needed different antibiotics for that. But they weren't overly concerned about that. But they still couldn't say they weren't happy to say for definite the necrotizing fasciitis had disappeared. He went back to theatre again on the Wednesday, again for more debridement. And then on Thursday, they took him back to theatre and then came and spoke to us and said that they couldn't do anything further for him in Addenbrooke's, and now was the time that he needed to be transferred to the specialist centre. So like I said, he needed an intensive care bed and he needed a burn centre. The local burn centre around here is Chelmsford, but they don't have a PICU there. So the next closest one was Birmingham. We were told to wait for a bed in Birmingham, but it may be a few days. But that night at 6 o'clock, we were told that there was a bed and that we were going. So we had to pack up as quickly as we can and get ourselves sorted. And then the retrieval team came at 8 o'clock. It took them 2 hours to get him ready for transfer. And then I went in the ambulance with him. And then my partner followed up. So we arrived in Birmingham about 12:30. I've never been to Birmingham before, in the centre of Birmingham, and that's where the Children's Hospital is. So we arrived there in the middle of the night and was taken to the intensive care unit. Tommy was settled into bed, he was stabilised, and then we were shown to a parents' room because there was nothing else that was going to happen overnight. So we managed to get a couple of hours sleep. And it was the next morning that we met our third hero, which was Mr. Wilson, the burns surgeon that was going to sort Tommy out. He took him back to theatre straight away again on that Friday to look at his wounds and assess them. And then he came back to speak to us, and it was then that we finally started to get a little bit of hope. He said that although the wounds were bad, they weren't as bad as they thought they were going to be, and that it was something that they could definitely reconstruct. The intensive care doctor also said that he didn't need to be ventilated anymore, and that they could take him off the ventilator, and that would obviously free him up more, and we could finally get to hold him. From there, he was taken to the high dependency unit of the Burns unit. They have their own specialised unit there, which includes its own theatre. The next day after this, it's not on there yet, but no, the next day after this was the first day that we got to hold him. And this was literally the first time we'd heard him cry since he was in Peterborough. And then the next day we finally got to hold him again. After the first week, they said they were going to try donor skin on him. They were going to use this just to cover the area, to act as a dressing, and also it would gauge how well his wound was for skin grafting. They put the donor skin on, but unfortunately after a week they had to remove it because it just wasn't doing anything. And we felt this was a massive setback, because we thought when we got to Birmingham things seemed to be going at a really quick pace, so we expected it to be almost quicker, and so it was a real shock for this to happen, because it felt like a massive step back. He ended up having to go to theatre at least once a week, if not twice a week, for nearly all the 10 weeks that we were there. This was mainly for dressing changes, for his comfort, but it did involve a general anaesthetic every time. He did end up back in intensive care twice while he was there. Once was due to pulmonary edema, which is fluid on his lungs, and then the second time he developed bronchiolitis, which is an infection. It's a viral illness that a lot of babies get. His wasn't bad enough that he wouldn't have needed to be admitted to hospital had he been well. But unfortunately, it led to him deteriorating, requiring oxygen, and then he developed a chest infection on top of that. He had to be on morphine for weeks for pain relief, and ended up and they had to wean him off this slowly, because he'd become addicted to it, and if they'd taken him off it too quick, he would have gone through withdrawal. So that had to be weaned off. There was complications whilst we were there. One time they were trying to put another neckline in, which is a central line to enable to give him drugs, etc. And then whilst they were using the ultrasound to find the vein, they discovered that he had blood clots in both his internal jugular veins. He was already on treatment for blood clots, which involved having injection twice a day into his legs to thin his blood, but this was another complication. It was later discovered that he also had a blood clot in his liver. They're not entirely sure how the clot came to be in his liver. They thought if he'd had a umbilical catheter, it might have been from that, but he didn't, so they're not quite sure how that happened. So he had to be on blood thinning injections twice a day, and when we were finally discharged, that meant I had to continue to do them for a total of 9 months. So finally, on the end of March, his wounds were looking good enough to attempt a skin graft, and this is post skin graft, and you can see it looks like he's got two little chicken drumsticks there, but that's where they removed the skin from to perform the skin graft. So it was then after his second skin graft that we finally got to see his back. We hadn't seen it in all this time, and he'd been going to theatre to have his dressings changed, but they did it on the ward this time, and this was the first time we actually saw what his back looks like. I've got a photo of it, so just to warn you, it's not particularly present. So this is Tommy's back after his second skin graft, but before his third one. And you can see the sort of the darker pink areas there are where the skin graft hasn't taken, so we had to have further skin grafts done. It does extend round to his flanks as well. He had his third skin graft on just before the end of April, and there's another photo there of afterwards. So that's after the third skin graft, so you can see where they've put it on and they've just left that there for it to take. We were finally discharged home on May the 7th, having spent 11 weeks in hospital in total. The wound itself, once we got past this stage, everything seemed to heal up fairly quickly. We didn't have any actually open wounds by the end of beginning of June. All the open wounds had gone. We were going regularly to checks in Birmingham, and then the next photo is in August last year. So you can see there things have started to flatten out around the edges, because that was one of our concerns. So we've continued to go up to Birmingham, and he is still under Birmingham. He is still under a haematologist for his clotting problems with the blood clots. They're not entirely they don't think there's any genetic reason for him to have had the clots apart from necrotizing fasciitis and the sepsis, but they just want to be sure, so we're still under them. He's still under the liver team because he still has a clot in his liver that, although it's still there, but they're now treating it as chronic. He's also got sludge in his gallbladder, which, if left untreated, could develop into gallstones, which is usually something that a lot older people get. But because of his poor health and poor nutrition to begin with, they're having to monitor that to make sure that doesn't develop into gallstones. And then this next slide is what it looks like now. So you can see there is massive improvements in that. It is looking really good. It actually looks much better than it does on these slides. He's got a couple of areas where he's got hypertrophic scarring, so you can see just along the edge there, and there's one on the side. If you go on the next slide, so you can also see how far it extends round to the front there, and at the side here as well. But considering what it looked like 18 months ago, we are really, really pleased with it. And you know, we couldn't expect it to have looked any better, really, than we'd never expected it to look this good. And then next one. So basically, that is Tommy's story. I'm sure there's probably bits that I've missed out, but I just wanted to go through it and explain what had happened to him. But Tommy isn't about necrotizing fasciitis. He isn't about MRSA. He's our little boy, who is just amazing, and we are just so grateful that he's still here with us. That's it. Thank you.
So the key learning points that we've had as a trust, I think the first thing that came to our mind when we learnt that Tommy had an MRSA, PVL MRSA, and we looked into the situation, was the missed opportunities to swab Debbie. So Debbie's a nurse, she comes into a high-risk group, and within maternity, we don't blanket screen in maternity, that's national guidance. We screen people based on their risk level. And Debbie had 2 missed opportunities, one pre-op and also because she had a C-section. So both of those things put her at risk. So at the time we did a lot of learning with the maternity unit. They introduced some audits to monitor. It's quite a difficult thing to monitor doing MRSA screens on when you're not screening everybody. It's difficult to get that data, but and there was a lot of teaching as well around how serious MRSA can be, and I think it's something that we talk about a lot. The infection control team talks about MRSA a lot, and the majority of the time it's a bacteria. It's in your nose, it's in your throat, but this is what the consequences can be of a serious MRSA infection, and it's really important that that is shared far and wide, and we want to use Tommy's story as a way of doing that within our own trust, but also further and beyond, so that other people can learn.
So it was good and bad. So I think in the NHS we're not always good at communicating with people, with especially patients or families, and so sometimes we had some really good information and really was kept up to date, and other times there was miscommunication which led to, from our point of view, a massive impact on how we were feeling. So, for instance, when we were in Addenbrooke's, we went out of the room just to go and get some lunch, and my mum and Tom's dad were in with Tommy, and when we came back in, we were told we didn't have to wear gloves and apron because we were in close contact with Tommy beforehand, so we didn't. The staff did, but we didn't. And when we came back in this one time, they were all wearing, our family was wearing gloves and apron, and we were told we had to. And I couldn't understand why, having been there for so many days, all of a sudden it was happened. And we were told, infection control have said you've got to wear them. So I then became quite hysterical because I'm like, I can't hold my baby. Now you're telling me I can't touch him, as in like feel him. And it turned out it was poor communication. And because my father-in-law was undergoing chemotherapy at the time for bladder cancer, he was told for his safety it was better for him to wear it to protect him, but not that we didn't need to. So if the communication had just been good then, it would have solved all that. And we had that a few times, even when we were in Birmingham as well. Or we found that because they knew that I was a nurse, they would speak to me in a certain, with medical jargon, but they wouldn't. My other half is not. He doesn't work. He's not in the health profession whatsoever. So they would be talking to me, and I would be understanding to a certain degree because it was difficult to take it all in. But I would understand what they were saying, but he would have no clue. And then he would become frustrated because he's like, I don't understand what's happening. It's my son too. You need to tell me what's happening. And so it did lead to, it was difficult then sometimes because how they would gauge how to, to speak to us. It's been hard. My part, because I've got to. I work in the trust and have done for a long time, and I don't want to work anywhere else. I really enjoy my job, things like that. So I was able to sort of separate maternity from the rest of the hospital in my mind. So it may sound strange, but I won't go down to the maternity unit. I will only go as far as Amazon, and then I won't go any further because I don't feel I can. It's also been difficult coming back because of what happened, but also saying that when we came into A&E that day, the team were absolutely fantastic. And I know I worked there, and I knew all the staff there, but I knew they would have done that for anyone. It's not just because I worked there, but they, as part of this, all part of the team, they all saved his life. If they didn't give him the antibiotics and the fluids and everything, he wouldn't still be here. So it's kind of a little bit bittersweet, really. Sometimes it's more difficult than others, but I can separate it, and it's got easier as time goes on. Yeah. So communication, like I said, we had some really good communication and we had some really, really poor communication that caused us a lot of distress. That had somebody explain things properly to us would have caused, it would have been so much nicer for everyone. It would have saved us getting really worked up and then, sort of almost demanding to speak to a doctor and, this isn't right, of all this, uncertainty. So that's what I've taken now. I try and explain as much as I can. You're not always going to get it right, but I do try, go out of my way to make sure that we're communicating better to patients because it's so important.
Brilliant.